Hello guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, in this video, I want us to talk about diuretics, and before we can do that, we'll need to go back and revisit the osmoregulation of the kidney, just to understand how does the kidney carry out this function of osmoregulation. Because if you're gonna give a patient drugs that interfere with water absorption, so you need to understand. So you need to understand how does the body does its own water regulation, so that when you give drugs, you understand exactly how do the drugs that you're gonna be giving, in this case diuretics, how do they interfere with this already existing normal physiology. So we'll start. So osmoregulation. Okay, so osmoregulation, as we all know, that it's one of the crucial functions of the kidney to make sure that we always have enough water to function as humans, so that all the systems in the body have sufficient water to make sure that we are not dehydrated. If we are dehydrated, so to make sure that we are not losing water again, or if we are overhydrated, to make sure that excess water is removed from the body, so that we don't get complications from overhydration. Okay. Now we'll need to go back and look at the structure of the nephron for us to understand. So this happens in there. We're going to be talking about osmoregulation as far as the renal system is involved. So, as we all know that each kidney has about 2 million, 3 million, 1.2 million nephrons around there. And that the nephron is the basic structure of the kidney. I will label these parts just now. And this is not drawn according to scale. Okay, that's our nephron. So this part, as we all know, with different marker. So this part, as we all know, is called the collecting duct. This one is called the distal convoluted tubule. And then this section here is called the thick ascending limb of the loop of Henle. And then this part is called the thin ascending limb of the loop of Henle. And then this is the descending limb of the loop of Henle. Then wish I could use different colors. This is this part here is the proximal convoluted tubule. This is the Bowman's capsule with the glomerular network, efferent arterial, afferent arterial. It's important to, this is not like deep anatomy and stuff, it's not going to be deep physiology as well, but it's important to know these different sections because there are drugs that target different sections of the nephron. So it's important to remember this. So here we have a proximal convoluted tubule, descending loop of Henle, thick ascending is important because there are drugs that work on this thick ascending only. Then there are drugs that work on the collecting duct. There are drugs that work on the distal tubule as far as the diuretics are concerned, right? Now, what I want you guys also to remember is that the efferent arteriole, it runs along the nephron such that the basolateral membrane of the tubules is a neighbor to this blood vessel. And the reason for that is because when you've got stuff that is inside the tubule, when that whatever, be it a solid or water, when it's reabsorbed, it's easy for it to move from the tubule itself into the blood vessel. That's why they're in close proximity for that purpose. So it's easy now for stuff to move from here, cross the tubule cells and into the circulation. So whatever that is that makes it to this blood vessel is back into the circulation. It's very close to the this vessel is very close to the internal nephron. So I'm gonna remove this just for us to get space. So remember the labeling. Okay guys, so there is our nephron. Now there are two systems that the kidney uses to do this function of osmoregulation. me say there are two ways that the body uses, or two mechanisms that the body uses to reabsorb water or to release water. The first one is aquaporins. Aquaporins. What are aquaporins? Aquaporins, okay, let me explain it this way. Remember, the cell membrane has got a bilipid layer, right? If we go back to our biochemistry or our molecular biology, okay, yeah, biochemistry. So the bilipid layer has got lipids around it, two layers of lipids around it with their tails and stuff. And this is what cell membranes are made of. All cell membranes have got a bilipid layer. The bilipid layer makes sure that it separates the extra cellular from the intracellular. But there are times when things that are in the extracellular has got to come into the cells, and there are also situations whereby stuff that is in the intracellular has got to move out of the cell. Now, as long as whatever that needs to cross the bilipid layer or the cell membrane is not charged, it's easy for that substance to actually cross. But if it's charged, remember, those lipoproteins, that bilipid layer is also charged. So because it's charged, when a charged substance has got to cross, it needs a carrier protein. So it needs a carrier protein. So these carrier proteins are usually embedded on the bilipid layer. So they are like, they're channels. They are channels. So they make sure that whatever that cannot move, cannot cross the cell membrane because of its charge, can be able to do that through the channels. So you get stuff going in like that, going in like that, or leaving towards that direction because of the carrier, because of the channels. Now there are so many channels, and different channels, they carry different things. There are channels that one channel can actually transport about 3 substances, and then there are those that only focus on one thing. So channels that makes it possible for water to move are called aquaporins. So this is our aquaporin. Aquaporin is a water channel. That's what it is, it's a water channel. So aquaporins, they make sure that water can actually move from the filtrate back into the circulation. Make sure that water can be reabsorbed back into the circulation. And water porins are very potent compared to your sodium water reabsorption system, which we are going to talk about. So if you need rapid water reabsorption, then aquaporins will do that for you. They are very, very potent in terms of water reabsorption. So aquaporins. Now aquaporins have got types. Actually,